Thank you. Thank you, Mr. Chairman.
Senator Sanders.
A lot of questions, limited time. So I'd appreciate brief answers, please. 1 out of 4 Americans cannot afford the prescription drugs their doctors prescribe. Do any of you have information as to how many thousands of Americans a year die because they cannot afford the outrageously high prices of American prescription drugs? Mr. Schiller, do you know how many thousands die?
I don't have that statistic.
Mr. Crowley?
I don't know, Senator.
Dr. McAwa?
No, Senator.
Dr. Kisselham? Dr. Ramasharman? Okay. Let me, the theory is, well, let me ask Mr. Crowley a question, if I might. Health and Human Services Secretary Kennedy has said that there is, quote, no vaccine that is safe and effective. He has also said that the polio vaccine, quote, killed many, 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 many more people than polio ever did, end quote. Do you agree with the Secretary?
Senator, I believe, and Bio believes, that vaccines are an incredibly important part of the public health. I have in my office a gift that was given to me many years ago. It's a picture of Dr. Jonas Salk, and I keep that in my office today. Vaccines have done as much or more to transform human health than any technology we've ever developed. They are safe and effective. They need to be rigorously studied, and they should continue to be, as we did during Operation Warp Speed for COVID. So we are perfectly aligned. Bio actually ran a campaign.
Okay, I beg you. Thank you very much for your
Thank
statement. Mr. Schiller, do you agree with Mr. Crowley?
I do. Vaccines are one of the great public health success stories.
Dr. McAwa?
Absolutely, I agree.
Okay. Dr. Kesselheim, I find it strange that we have a situation where over a recent 10-year period, 14 major pharmaceutical companies spent $87 billion more on stock buybacks and dividends than they did on research and development. And and CEOs, as I mentioned a moment ago, of the major drug companies make over $100 million in compensation. What does that tell us a little bit about the goals of the motives of the major drug companies?
Well, as with all companies, they're responsible to their shareholders and primarily responsible to their shareholders. And so I think what it also says is that if we are trying to stimulate innovation, it makes most sense and it is most efficient to give that money to where that innovation comes from, which is at the academic institutions where it is discovered, and not to the end product to the end of the stage where the large pharmaceutical companies are spending only about 10 to 20% of their revenues on innovation. So for each dollar spent through the NIH, you will incentivize a lot more innovation than for each dollar spent to those in those.
What you're saying is that financing research should be the goal, not making stockholders extremely wealthy or outrageous compensation packages for the CEOs.
I mean, we need to make sure that there is a reasonable market out there for drugs, and there is, and drug companies make a lot of money from it. And as we're thinking about incentives and ways of trying to encourage innovation, I think the most important way to do that is to try to, raise the ground and to grow the amount of innovation that comes out of where it comes from, which is from publicly funded research.
Okay, Dr. Ramachandran, you are a practicing physician working with low-income and working-class people. What impact does the high cost of prescription drugs have on the quality of life of your patients?
It can be life and death, the difference between life and death for many of my patients. Because of the rising cost of prescription drugs, there are oftentimes choices that they're making at the pharmacy counter or when they come to clinic asking me if I can select which drugs among a lot of the life-saving drugs that they're taking that they could maybe skip that month or not take because of the cost. When they go to the pharmacy counter, they have to make decisions between paying for that drug or paying for their rent or other needs as a part of their life. So it has made a huge difference. And oftentimes what it's led to is people showing up to the hospital because of delayed care, because of not treating their conditions, and sometimes even death amongst my patients.
Thank you very much. Thank you for the work you do.